Well, my name is Josh Cobley. I'm the founder and CEO of Convivio Health. Founded it as a return to work company initially in 2007. And our focus has always been the care of injured workers and trying to improve that from intake to discharge, their experience, the stakeholders' experience, and of course, the experience for our clinicians.
My name's Anu Kalpati, and I'm a physical therapist, and I serve as Director of Operations at Convivio Health. And I've been with Convivio for about 1.5 years now, and I have clinical oversight over all of our programs. Convivio Health is based in Washington, in the state of Washington, and we have 2 locations. We have a clinic in Linwood, and we have a clinic in Renton. Both are in Washington state. We have several service lines. We provide physical therapy, occupational therapy, speech therapy. We do mental health, neuropsych. And we do 2 unique programs, and this is with the Washington Labor and Industries, which is the workers' comp, the payer is workers' comp. We collaborate with them and we run 2 specific programs that are funded by Washington Labor and Industries. One is a program for injured workers who have chronic pain. It's called the Structured Integrated Multidisciplinary Pain Program. And the other program is for individuals or injured workers who have had traumatic brain injuries. And usually it's, mild to moderate, and we're dealing with complex concussions. And both programs are intensive outpatient programs. So patients who qualify to participate in those programs. The pain program runs for about 4 weeks, and our patients are here with us for about 6 hours a day, and they get a combination of physical therapy, occupational therapy, and they also work with our mental health counselors, and we have medical oversight as well in the chronic pain program. Our brain injury program has PT, OT, speech therapy. We have psych, neuropsych, and MD as well. And both programs have the involvement of a vocational counselor as well, because the goal is return to work, right? The goal is we are serving a very niche population of injured workers. And the goal is how can we influence their recovery and, get them back, integrate them back into home, community, and work.
And both of those programs are CARF accredited. We're about to go through that process again right now. So it's very involved, very high skill level for people that are struggling, and we're meeting their needs often after they've been through the system for quite a long while. So the coordination of care is hugely important, especially with the big teams that we have. Our systems have started as basic as you can start. When we first started, it was not handwritten, but typed. And then we went from a system where everything was typed to using SharePoint as a folder system and manually billing everything. And it was difficult, very difficult. Then, we started using an electronic medical record system, which was a sea change for us. It was really quite something. And it really helped us along the way of scheduling, billing, just organizing data, right? And organizing things for the patients. But, with, a lot of things in life, there are limitations to the system, and we were having difficulties with, tracking things and getting data out, understanding what the reporting was and getting the reporting to work for us. And, it's not a small challenge to do that with a multidisciplinary company. It's not. A lot of companies are just built for one thing, and it's hard for them to adapt. At the same time, we were, struggling with getting regular improvements to our processes and seeing, we still had so many blind spots, and it's difficult when you're working with a big company, and I won't name names, but when you're working with a big company and you have customer service that turns over and turns over and turns over and turns over, hard to get traction with, a project. And so, AI starts to come along, and it really has shown some great improvements. And we are looking at, okay, how do we use that new capability with our systems? And the only real way to do that is if you have a true integration. And that's, we reached a point with our old system where we're like, okay, we're waiting and waiting and waiting for an API to come out. And yes, it's coming. Yes, it's coming. Yes. And it never came. And I'm sure at some point it will. I mean, and it's a big task to do that with a large company, but we just had to make a change. So we spent a lot of time and effort. And when I say we, I mean Anu. Anu, you did a lot of, just webinars and meet and greets. And really, when we came down to the capabilities and what we thought was going to be a team that would work with us, that's SPRY really did a great job. It's still nerve-wracking to make that switch, but we switched, and not long after that, we were seeing that we could integrate, we could access the API, we could start to see the data and how it was structured, and we can work with your team to make changes when we need to. And I know, nothing is ever super easy because it's a complex system, but there is a great deal of flexibility and a great deal of willingness to help and consistency with that. And it moves fast. So we know that with the AI that we're using right now, we are really, really focused on improving our systems, and we can see what's going on. So tying those fields together, it's blowing our minds, quite frankly, what you're able to do right now and create. And having a willing partner that's going to allow us to do those things has been really something. Our goal is to improve at every single level what we're doing, because we know that impacts patient care. We know that even the smallest thing, figuring out timing of one program intake and shortening it for somebody is a big deal, because it's their life. And we feel that in our gut. And working with this team right now, working with your team, we don't feel the barriers are there. We feel like the walls are coming down, and it's a wonderful feeling.
Yeah. So I think, from the time that, we onboarded with SPRY, right? I think what really helped was, they understood right away that, we have some really unique programs, and they were willing to work with us on just building disciplines from the ground up that didn't exist, right? We're one of two CARF accredited brain injury programs in the state, right? So they didn't have a discipline for the pain program or for the brain injury program, but they were extremely willing to set that up. So I think that was really powerful, right? And they said, hey, let's have a conversation. Tell us what your needs are, and we'll help you figure it out, right? And then I think just that level of collaboration from the very beginning, I think SPRY, just in its native form, right, is all about efficiency. And the principle behind it is, how can we get clinicians back doing what they want to do, which is, they want to be patient facing, they want to be working with patients. So you have the Scribe AI, right, which is, we use the Agentic AI, and it's so incredible. And it's such a step up from the ambient AI. We explored that as well in the beginning, and I think the Agentic AI really is a game changer, for our clinicians who are doing one-on-one visits, right? And there's an impact like across the board. One is at the patient level, right? You're not really dividing your attention. You can be completely present with your patient and listen, and not be worried about, tracking numbers and writing down notes so you don't forget it later. And then, the biggest, I think, I think the heaviest part for a clinician, like in their workday, is I have all these notes I have to get done, right? And to be able to solve for that and have it be a good, efficient solution is, I think, and to be an employer who's able to do that for their team feels really good. And I think SPRY has been our partner in being able to do that, right? So I think on the documentation side, I feel that's kind of been the biggest change for us. It's one that we're still, we're learning to utilize it. We're still on our learning curve there, but I have some clinicians who are already using it really well, and but we see the potential there. So that's really exciting for us. And I think what I really like about SPRY is also the efficiency piece, and the AI piece extends to the administrative portion as well, right? And the team is given equal importance to those back-end processes, which I really appreciate, because that part of the business is as important to the front-facing side of the business, right? And they both go hand in hand together. So the way that the intake is laid out, the way that the facts analysis that happens, and they've been able to figure out what parts of this process are redundant. Like, let's automate those processes, and you still have the human element in for the ones that really require judgment and decision making, right? Which is ideally how we want it structured, right? So I see we align with the basis of that, of how that's structured, and so we see it working really well. For us in the future, we've been we started using SPRY in March, and so the last 3 months we've been through so much change, and it feels like we're still learning. We're still learning what's the best way to use SPRY and to be able to use all its capabilities, right? But even in the 3 months that we've been here, just as an organization, we've been through a lot of change, and the reason is because we have so much more visibility into the data, into the numbers that come out of it. And, we feel like we can trust the numbers, right? And to be able to track, right? And to kind of get down to line item by line item, to be able to drill down. I think that's, it's really helpful to be able to see that. It's something that we were missing. And, it's really important for us to be able to have that.
We see just having access to your data, and being able to, a couple of us are building systems on the back end that are super custom for just our market, right? Because I've been in this market 20 years. I understand the market very well, but now I can take that data that we're creating and taking those notes and everything we're creating and really put it into just beautiful format for clinicians that just makes it so much easier. And we found that, within our programs, within the documentation requirements, there are a lot of areas where we have clinicians doing one thing because it's in the billing and the chart, and then it has to be pulled into other areas, and then other areas, and then another area. And then, so a lot of different, insurer mandated reporting that's very custom, because it's a custom program in a custom state. It has to be reproduced over and over again. So we've really tackled a lot of that, and we're getting rid of a lot of it. If it's written somewhere and it's the truth here and here and here, we make it happen. And we can do that because we do have that access, and it's nice. It's nice. We can have one step where a clinician does it in their daily note. We can pull it into a reporting note, and as soon as they sign off on it, it can go to the chart, and it can go to through the facts to where it needs to go. It doesn't require that many hands to do it over and over and over again. And so, I still can't believe what we're able to do with this stuff right now. It's pinched me a little bit. We're getting better at it, but it's nice.
one product feature that I really want to highlight is the group notes and the group scheduling. Our two programs that we run here, the chronic pain and the brain injury program, we run them as cohorts and we run them as groups, right? And since patients are here for 6 hours a day, that's a lot of notes that we generate because we write session notes for every session. So I had taken this idea to the product and the tech team at SPRY of, can we, develop this feature of, being able to write in one note and having it push to different notes. So we're not, writing in 6 charts if you have 6 patients in an hour. And, it was an idea in March and they implemented it in June. So just the fact that to go from idea to something that actually works is pretty incredible. And, we went live 2 weeks ago and it has just, it's really been a game changer for us because for a lot of our clinicians, when you do 4 or 5 groups in a day, and that's a lot of notes that you generate, right? And to be able to navigate that lever and really bring in some efficiency and just reduce the cognitive burden for clinicians has been huge. So that's our, the latest, I think, like SPRY product that, they pretty much built it out, I think, for us, and I'm sure there'll be a lot of other people who can use it as well. But, and at every point, they made sure to take our feedback to make sure that they're building it out to, in a way that meets our requirements. Both, the product team and the customer support team, extremely responsive. I really like the Slack channel and, being able to, at least communicate, right? And we have, weekly meetings with our account manager. And it's really nice. It feels like that support, we had a lot of support kind of building up, right, during our onboarding. And then to still have that same level of support and to still have that same level of responsiveness 3 months in is really nice. And we feel, fairly well supported, right? It doesn't mean that, everything gets resolved in a day. I think that's unrealistic. It's also an unrealistic expectation, from us, but at least to communicate, right? And to say that, hey, this is how long, this could take, and just the level of responsiveness has been, is really helpful. So I think that's definitely something that stands out for me. In the clinical realm, I know that, on the billing side, right, it's our operations and processes have changed quite significantly. And, if you have a clean claim, billing it out is like literally one click away. So I think that's also extremely powerful. Like, we had a really manual process before that. And to be able to, retain accuracy levels, right? And to still be able to automate your process, I think is really powerful. And I think SPRY has been, influential in helping us get to that. I'll start with how we were doing it before. So if you take our chronic pain program, right, patients are here from 9 a.m. to 4 p.m. So they have typically 6 appointments in a day. And then, across 4 weeks, right? So we were pretty much doing 1 appointment for every hour, and this was all manually done. We could do recurring appointments, but, it was still extremely laborious. It took a lot of time. And now the way that SPRY has designed it is from the scheduling aspect, is you have a patient roster for the group. And then, you have start and end dates, and then you go onto your schedule and then you just schedule the group, right? So you're not adding in each patient manually. And that's huge, from our schedulers are loving it because it takes so much off of them, right? And to be able to give them back time in their day is also, really powerful, right? Because they have more than enough to do. So if there are ways that we can make their day efficient, right? It helps just all of us as an organization. Again, what Josh spoke about, like speed to care, that is one of our core values. And we try to emulate that like in all our processes, right? Like whether it's on the clinical side or on the admin or billing side, we want to be able to do whatever we can to optimize backend processes so patients aren't just waiting out there to get care. And, things like it might have taken, our administrative staff or a coordinator to map out someone's schedule, something that maybe took, 5 or I'd say realistically 3 hours or 2 to 3 hours is now down to maybe like 10 minutes, right? From the notes side, right, the way that it works is you have a group note that you can click on, and every field, so fields are note structured in a SOAP note format. And for every field, I can write either a global note that will push to all charts for all the patients who are in the group, or I can do custom, notes, right? Like if I'm taking a blood pressure, it's going to be different for every patient. So I want custom notes. Again, my subjective field is going to be different, right? Everyone's going to feel differently and, have different things that they want to chat about. So I think to have the flexibility to do that, because that's the difference between it just being a templated note. You're copy pasting the same thing into 5 different charts, but this gives you the opportunity to take it a step further and to truly customize it, right? And that's what we want to do. We want our notes to be reflective of the work that we did in the session, and yet do it in an efficient way. And I think the group documentation feature is really the answer to that. So it's been so helpful for us. We're still in the early stages of using it, but I think it's something that's going to save our clinicians just a lot of time.
Yeah. One of the things I was thinking too was it's not just that we can pull data, we can actually push data
right back.
We can push data back into the system, and we know it's secure there, but when we get a new patient, there are places that we have to go to get that data and then input it into SPRY. But now we're finding that we can actually pull it down in different ways using even RPA, or robotic processing. We can use that sort of stuff to bring the data to us and then route it into SPRY. And that's really great because it saves a lot of potential places for error too. With just, you've got spellings of names, dates of birth, all of these things, claim numbers. Any one little typo somewhere is a potential problem. So when we can automate that sort of thing, and that's just like insurance authorization, nobody really wants to listen to a phone call to get the claim data.
Yeah.
It's like we're slaying giants. It really is. It's pretty cool.
Yeah. I think like it has issues, right? Which when you develop something and we go live, for the first time, of course there's going to be glitches in the system. And we set our team up for that, and we said, hey, there is going to be a ramp up, right? But I think just the fact that the team has been really responsive, and helping us kind of clear out issues and work through errors, I think has really helped smooth the transition, right? And so I think it's both ways. I think it's the fact that the product team, Viraj, and the tech team, everyone has been so responsive, and hopefully we've been okay to work with.
I hope so. I told her, I said, look, we're going to SPRY. Okay, but I will help them if they're helping us. And that's the way we feel.
Yeah.
We do feel like we're being listened to, we've been helped.
Yeah.
And so we think we're excited for you guys, and we think you're going to do great things.
Yeah.
But it feels good. It just feels good that we have that level of interaction, and that I know that when Anu's reaching out, she's going to get feedback. and it's going to be timely.
Yeah.
And it is really nice to have the Slack channel
Yes.
connection with you guys. So it's, I'm like, I was on a call 2 weeks ago and I'm like, oh, I'm talking to the CTO.
Yeah.
That's pretty cool.
What I do know is, they've helped us kind of set it up. We have some unique customers in terms of workers' comp and self-insured, right? And they all have different requirements and pathways. And SPRY has been really an active participant and an active partner in helping us set up relationships. I know that we're doing way less paper claims now than we did. I think that's huge for us.
Before we were working with a different organization, and I think that they didn't have the connections with the insurers that are already built into the system that you guys have. And because of that, we were doing a lot of those, what are those, HICFA?
Yeah.
HICFA forms? Just drives me crazy that we would have to do that. And then if it was like a little bit off at the bottom, printed out wrong, maybe it was too close to the margin, denial. It's like, okay. Yeah, we find also there's an interesting concept that we were talking about yesterday with my CFO and I. When you have the ability to look at the data longer term, and you can also start to establish pattern recognition in how is that insurer, interacting with us? Are they interacting in good faith? And if you're watching insurance companies, you're on notice because that data, everybody has access to it now. And you're going to be able to see, are people acting in good faith? So it's a transparency thing. It's going to be, a different world for everybody.
Yeah.
Yeah. That speeds things up too. If people are accountable, then we're not waiting on care for somebody. I'd say there's a built-in speed function, and we talk about speed a lot with speed to care. And it's not rush through care. It's give people their lives back as fast as we possibly can, and make sure that things are processed as cleanly and as efficiently as possible without the redundancies. And every time we solve a little piece of that, it's profound because we're able to reduce some of just the admin functions, and having people. I have this saying: nobody is passionate about getting insurance authorization. And maybe somebody is, but that's freeing people up to not be doing those tasks that really, in this day and age, should be automated. It's a good thing, and we're gonna, people worry about AI, and rightfully so. We all should be wary of it, but there are some things that if we can take those mundane tasks away from people and make it consistent, so things don't get lost, and it just is. It's additive at every level of the business, and it's making everything. It is making everything faster and clearer. So it's, I go on about it. It's like a crazy preacher, but it really is true. When we can simplify our systems and makes things clearer, then everybody also gets clearer expectations. They know what they're supposed to be doing. It makes it easier for them to understand their role. And we're still at the very front end of this. And we've got quite a bit of work to do, but we are excited because we see a path. We actually feel like there's a path to getting a handle on some of these complexities and these nuances that are, we carry around this knowledge, but we don't want it to be tribal knowledge. We want it to be something that lasts and that can also impact other organizations in our area. We're really looking to push what's happening in workers' comp and bring it to a much, much higher level in our state. And we think getting this data in the right places in formats that can also be used by other stakeholders, right? It's really I'm excited about it, and I think there's a path forward. And and then, like I said, unlocking the data and unlocking the API and our access to really it's our own records
Right.
that we're creating. And we're able to organize that now for our patients and our stakeholders. There's some really, really, really cool things that are happening. So I know we're both excited about it, and
possibilities are endless.
the possibilities are endless. They really, it feels like it. It really feels like there's, we're taking the things that we've been hating for 20 years and we're able to wash them away.
I know, like, I'm always like coming up with like new ideas. I'm like, hey, we have access, to this data now. Like, let's do this. Like, let's try all kinds of things. And it's really powerful. I think, I heard Bridge say this, when he was talking about API, about, that's how that's kind of the future, because we're not contingent as an organization. We're not contingent on the EMR's roadmap, right? It's not like I have to wait 6 months for you to release a product feature or for you to, finish working on this report. I have access to raw data, and to be able to manipulate that, to be able to see metrics that are important for our organization and KPIs that are important for us. I think that's really powerful. And I think that's what has all of us really excited. And I think we're seeing that throughout the organization at all levels, right? Like, it's easier for our admin staff, it's easier for front desk, it's easier for clinicians, the patient experience is better, we have a portal now. So I think just being able to impact at every level, I think is probably what I really, the phase that we're in right now, that's what I'm really enjoying about SPRY. And, and some of them are more well-developed than others, right? Some we're still working on. But the fact that we have a path and, we see the potential and also for us as an organization, we only have the bandwidth to take on so many new things and to roll out something, right? So we have to phase that out as well. So just knowing that, hey, this is the possibility, these are the possibilities that lie ahead, and this is everything that we can do. And, there's so much that we don't even know about.
Yeah.
So,
yeah. I think I've covered most of what I was thinking, but as far as it's always a learning curve, right? But I feel like the curve is it's not as slow, it's not as a low trajectory anymore. It's, hey, once we tackle something, we can tackle it a lot faster. And I mean, we're able to make so many different changes. And if we're able to do just the speed of change on these individual little tiny pieces of the business and the process for each patient and the process for our stakeholders, that makes a difference to each one of them. It touches them in a different way. And if they know that we've actually had the mental energy to think through things, because we're not wasting our mental energy on insurance HCFA forms, right? That does pay itself into different locations, because now we can start looking at, hey, that's a real quality issue. We can help with that. And before it was just, if you're putting out fires all the time because you don't have clarity, any business knows that, and we have some of our business minds are from a manufacturing background, and they've had their hands in that. And we've learned a great deal in seeing how it will apply to process improvement is care improvement. And it's for sure. When you walk into a doctor's office and you have to sit and fill out a form that's, for 20 minutes when you've already done that one, right? Or, your doctor is behind the scenes and they're waiting on something, and now they don't have to as much. And you're seeing these improvements, and your time is more respected because people have the capacity to do that. So it's
yeah.
We have a new fire in us right now because we have the ability to do things. Yeah. And that's been freed up because we're not worried about some of the other things.
Yeah.
And it's fun when you can do that. it's really,
Yeah.
you know, you have your creative energy now. And, you know, it gives more purpose and meaning
Yeah.
to your work if you know it's making an impact.
Yeah.
And you know, there are things that you can do. It's
Yeah.
it's a lot more fun to work now.
Yeah.
It's